Thank you, Mr. President. I rise tonight to talk about a couple of issues I know that we'll be considering, at least I hope all will be considered in the negotiations that are underway. I know later in this hour we'll be joined by three of my colleagues, Senator Whitehouse, Senator Blumenthal, and Senator Duckworth. Each of us will be talking about these issues from a different perspective, but all focused on those in our society who are most at risk in the midst of this worldwide pandemic, in the midst of this economic and jobs crisis that we're confronting right now. We know that this is the most difficult public health crisis in a century, and one of, if not in the top two job crises we've ever faced. And when we talk about Americans who are most at risk, among them are, of course, older Americans. Tonight I'll spend some time talking about older Americans in nursing homes who are at risk if we don't take action. People with disabilities who need the benefit of, as do many older Americans, need the benefit of home and community-based services. Third, Americans who are in communities of color who need the benefit of Medicaid, among other programs that we should be focused on. Let me start with nursing homes. We know that in the context of nursing homes, the care that's provided there is the highest level of care for an older American or sometimes a person with a disability, and that's skilled care. We also know that that's care that's provided to men and women who have done so much for the country. Americans who have fought our wars, worked in our factories, built the middle class, built America in so many ways, and gave us life and love. And all that they ask and all that their families ask is when they're in a long-term care facility, especially a nursing home, and that they're receiving skilled care, that it's quality care, and that in the midst of this crisis, that we're taking every step possible to protect them from the virus and to keep them safe. Unfortunately, that hasn't happened in America today. As we speak tonight, more than, and just a couple of days ago, the number was lower than this, but now it's more than 62,000 Americans have died in long-term care settings, most of those in nursing homes. When you add up the residents who have died, contracted the virus and died, with the workers who have died, more than 62,000 Americans. That's about 40% of all the deaths in America. We have to take steps to get those numbers down, both the death number as well as the case number. And of course, the two are directly related. A number of months ago now, Senator Whitehouse and I, and he joins us on the floor tonight, introduced Senate Bill 3768, which was the Nursing Home Protection and Prevention Act, which was a $20 billion proposed $20 billion investment in best practices. The tragedy here is that we know what works to get the death number down in nursing homes. We know exactly what works. And those nursing homes that were implementing these best practices months ago, way back sometimes in early March or even in February, are the ones who had lower numbers, fortunately, of deaths and case numbers. We know that you have to invest in a series of best practices. That means having enough personal protective equipment for everyone in a nursing home, but especially the residents and workers. We know that that is essential to keeping people safe. We know that testing is part of that, of course, and having the capacity to test frequently and to have results transmitted very quickly. We know that cohorting, and it's not a term that we hear a lot about, but it's a very simple concept. Cohorting means you separate the residents with COVID-19 from those that don't have it. And as easy as that is to say, it is more difficult to institute in a nursing home. Sometimes you have to retrofit. Sometimes you have to take other steps that funding is needed for. But cohorting works. It stands to reason, but we know it works now that we have some experience with the virus. We know that surge teams are critically important as well as part of these best practices. If you have an outbreak in a nursing home, we've had so many examples of that in my home state of Pennsylvania and so many other states. When that happens, when the virus is spreading and there's a crisis in that nursing home because of the virus, you might need more help. You may need more doctors or nurses or certified nurses assistants or so many other critical personnel in that nursing home. So $20 billion is a good down payment on protecting Americans in nursing homes. So our bill would do that, and I'm grateful for the help of Senator Whitehouse as well as so many other members of the Senate who joined in that bill. Unfortunately, the bill proposed, I guess it was July 27th, some of the last days of July, the bill proposed by the majority has no meaningful investment in these best practices. And we have to ask ourselves, I guess, is this what America is going to settle for? The greatest country in the history of the world is just going to throw up our hands and say there's really nothing we can do. It's a pernicious virus, and the virus is spreading in settings, in congregate care settings like nursing homes, and you have individuals who are particularly vulnerable, so there's not much we can do. That is a defeatist, anti-American attitude. We know we can get these numbers down if we make the investment. The America that we claim to be would have a full-court press, a pull-out-all-the-stops effort to make sure that we get these numbers down. So I don't think most Americans believe that we should throw up our hands and surrender to another 62,000 plus deaths a couple of months from now, which is where we could be headed if we don't take these steps. Now, no one would assert that we can get these numbers down to zero, or there's some magic wand that will allow us to remove this threat from those we love so much in these nursing homes. But my God, in America, we're not going to take steps that we know will work to get the case number down and the death number down? I think America's ready for an action plan that has been developed here in the United States by smart people who know how to attack this problem. So that's issue number one among the most at-risk Americans. Second, in terms of at-risk Americans, older Americans and people with disabilities, they need the benefit of home and community-based services. Again, the Republican bill proposed by the majority here in the Senate doesn't mention Medicaid. In order to attack the nursing home issue, the nursing home death problem, or to invest in home and community-based services, we need to invest in Medicaid. We must stabilize and strengthen home and community-based services to keep older adults and people with disabilities both safe and healthy. And to do that, you have to pay the workers more. The workers should be paid a living wage, and those workers, when they're going into a home to provide that critical care, should be provided the personal protective equipment that they need to keep themselves safe, but also that person with a disability or a senior needs if someone's coming into their home. Without sufficient dollars, human service organizations cannot recruit and retain the direct service, or I should say the direct support professionals and personal care attendants who provide essential health care and community inclusion services for seniors and people with disabilities. Just one example among many of a picture, an enlarged picture of Marissa. She's from Allegheny County, Pennsylvania. And you can see by the picture, and you may not be able to see it from a distance, but on the T-shirt she has is "Proud to be your neighbor," and you can barely read the word "giant eagle." That's one of the great supermarket chains in southwestern Pennsylvania. But Marissa uses home and community-based services to live independently. She's a volunteer at a food pantry, and as I said, she works at one of the Giant Eagle grocery stores, and she's done that work for 19 years. All these years later, she is one of the beneficiaries of this program where she can get services in the home and in her community. The key to this is without dedicated dollars, agencies like Achieva, one of the many agencies that does this work, that provides such services, these agencies will not be able to provide services that people with disabilities like Marissa and families like hers need. Pennsylvania, like many states, has so-called Centers for Independent Living. They told me just last week in a phone call that helping people move from a nursing home or a congregate care setting, where often the risk is higher with the virus, moving people from that setting who want to go into a home or an apartment, often their ability to move those people is fully dependent upon the dollars that they have, the funding that they have. They've been able to move some people, but very, very few, because they don't have the funding to move them. Another implication of this concern we have is that direct service providers have scaled back these services. Most don't have enough cash reserve for longer than a month. Just imagine that, because of the lack of funding. Now, I introduced a bill 4 months ago, Senate Bill 3544, which provided dedicated dollars to respond, but it wasn't until the HEROES Act passed by the House, not yet passed by the Senate, but passed by the House 10 weeks ago, included provisions of my bill, which was supported here in the Senate by 27 senators. Mr. President, I have just two more issues. One is Medicaid, and the other I'll address is on the liability debate. Medicaid, of course, we know what that program is. It's been around since 1965. Medicaid is the program that helps 75 million Americans. If you add up the children in Medicaid, about 31 million children, people with disabilities, another 9 million, you have roughly 40 of the 75 million. So Medicaid is not just a program, it's a program that saves lives, maybe ever more so in the middle of a public health emergency that we've been in all these months. Medicaid's also, I believe, a reflection of who we are as a nation. It reflects, I think, as well, whom we value. And that's why Medicaid is so critical to seniors living in nursing homes, sometimes from relatively middle-class families who could not afford long-term care. So many Americans with disabilities, as I mentioned, 9 million at last count, and of course, 31 million children, many of them in rural Pennsylvania, rural America. In fact, if you look at it by percentage, it's often the case that in rural counties, there's a higher percentage of children on Medicaid in the Children's Health Insurance Program, a higher percentage in a rural county than children in a county that has a lot of urban communities in it. So rural and small-town America depends heavily upon Medicaid. It depends upon Medicaid in another way when you consider rural hospitals. Often the largest employer in a rural county in Pennsylvania, or the second or third largest employer at least, is a rural hospital. We've got 48 of our 67 counties that are rural, and in those 48 rural counties, more than half the top employer in the county is a hospital, or I should say the top or the second or third highest employer. So in the top 3 employers in most rural counties, you've got a hospital, and Medicaid is so vital to those rural hospitals, operating on thin margins and ever more stressed in a pandemic. Medicaid expansion, of course, made it possible for millions of Americans to get health care through the Affordable Care Act. And now, we just saw yesterday in the state of Missouri, the vote there to expand Medicaid, and it's been happening in a lot of states that may not have embraced Medicaid expansion a number of years ago, now embracing it. Medicaid is a safety net in this time of crisis in terms of the economic and jobs crisis we're living through. It, of course, impacts state budgets. One of the biggest expenditures in state budgets is Medicaid, and when people lose their job, for example, in our state, we've got our unemployment rate in June was 13%, 821,000 people out of work in Pennsylvania. In some counties, the unemployment rate is 14% or 15% or 16% or 17%. So when 821,000 people are out of work in a state, a lot of them have lost their health care, and they turn to Medicaid. Now, in the Families First bill, way back in the early part of March, the matching dollars, the so-called FMAP, the federal matching dollars for Medicaid, was increased by 6.2%. That was a good step in the right direction. But governors in blue and red states will tell you now, as will a lot of other people will tell you now, they need an additional increase in Medicaid. I think the 14% FMAP or matching dollar percentage in the HEROES Act in the House made a lot of sense. I hope we can get to that number in the bill that we're considering, or we hope to be considering soon. The Republican bill does not have additional dollars for Medicaid, matching dollars, despite the fact a lot of Republican governors around the country have asked for this kind of help. So I hope that will change as the negotiations move forward.